Hello and welcome to the second in a series of 3 training videos on developing and implementing individualized services and supports. I'm Mark Brennan, Project Director for Continuing Education Television at the Missouri Institute of Mental Health in St. Louis, Missouri. And with me again is Barb Malone-Bequette, who has 30 years experience in both publicly funded and privately funded mental health organizations. Hi Barb, how are you?
Hi. How are you today?
I'm doing well.
Good.
We had originally started our video on just identifying the divisions of the Department of Mental Health that provide services to children and adults in Missouri. And in that program, you talked about all of the different aspects of assessment for children, adolescents, and adults, and the service systems that are put in place for them. And we talked about wraparound as a philosophy of care. And we also talked about what it meant for the system of care to be in place in terms of recovery and, recovery for children and adults. In the second video, I want to get a little more specific with regard to competencies for those people that provide the services to the clients. Can we do that?
I would be glad to. It's going to be hard for me to separate out wraparound services, team philosophy and responsibilities, and the individual competencies of community support workers, because I firmly believe we all have to work together to help folks move along their road, their journey to recovery. We talked about the system of care, as you mentioned, and the wraparound philosophy. And then we're getting down to what does a community support worker do in the context of a team. And then there's different teams we need to talk about. There's a child and family team that might be created to develop a wraparound plan, an individual plan.
Who would do that?
Okay, in the child and family, who would put that together?
Yes. Yeah.
That community support worker that has accepted the job of working with a particular family will put together, through a strengths-based quickie assessment of what are the needs, what kinds of services need to be plugged in to meet those needs, and who is involved with that family and that child in their life. In a child and family team, it could be the child themselves, the parents or the guardian. It could be grandpa, it could be the pastor, could be the landlord in the apartment building, it could be the teacher, some social services folks, juvenile justice folks, and the professional staff that might be serving that family. All of those people come to the table and work as a child and family team to create a wraparound plan, which is individualized and strengths-based.
It's hard to say.
It is hard to say. Then there are the teams of the community that create that system of care, where all of your public and private entities that are interested in providing services for those children and families that are struck with that disease of serious emotional disturbance. Then there are teams within the agency that the community support worker is a part of, and that team could be other community support workers, could be a supervisor, could be a doctor, could be a nurse, all those folks that also touch all the children and families that agency is providing out of that team process. And the team process is something that doesn't happen unless everyone is committed to bringing information to the team, sharing information, getting ideas, getting thoughts, coming to some consensus of opinion on service provision for a particular family. And then the community support worker will take all of that stuff and internalize it, externalize it, use it in order to provide services for children and their families.
Okay. So if I understand what you're saying, there's a team in an agency that's comprised of various people who have different perspectives on how this child might present themselves.
That is true. And we're talking a lot about children and families right now, and I think that's where the system of care and wraparound first got started, as I had mentioned earlier. But also this can happen for adults too. And community support services in the program, also for adults, could include the day program staff in that team.
Okay. So I'm trying to draw a picture in my mind about what that team might look like. And I think what I'm hearing you say is that there are people who have various different disciplines: nurses, doctors, psychologists, social workers, generalist caseworkers, basically, who commiserate with each other and the client over what might be the best approach.
And another member of that team might be a community support assistant, which are peers in the community that suffer themselves with a serious and persistent mental illness that can be of great assistance, or it could be a family support person that is kind of a parent-to-parent support service. And all these people come together as part of the team of the organization.
So this is where the rubber hits the road. This is not just philosophy. This is where things actually happen.
It's where the work happens. And everyone must realize on a team that their discipline, their credential, needs to be left at the door. And that people are coming together to talk about individual people and what services need to occur, what's going on in their lives, what needs do they have, what assessments, what programs, what things need to be put in place so that their road to recovery can be more successful.
So, and I'm interested in the community support worker's job and some other folks' job too, community support assistant. What would a day look like for you or for me if we were a community support assistant? What would I be doing?
Well, I'm smiling because when I used to hire and train community support workers, I would say you would create a list of for your agenda for the day, and usually you never got to number one. A day of a community support worker could be one of collaborative meeting, a team meeting, which then flows to emergency calls. I'm in trouble, please come and help me. Could be taking someone to the doctor's office, could be developing an individual plan or participating in a wraparound child and family team meeting, could be filling out papers, could be documenting progress or lack thereof on folks. It could be a meeting with a doctor to assure him that yes, this mother is picking up the medication and is making sure that their child is getting the medication that has been prescribed. It could be transporting a group of individuals to a day program. It could be taking someone to their job to see how they're doing in their new employment program. The community support worker, I always said, was a jack of all trades, and they're constantly changing hats, and they're constantly having to be flexible, and they have to be able to turn on a dime.
So the team is made up of community support workers and other people, and I'm curious, are community support workers assigned a number of clients? How does that work?
Well, yes, I guess I should say just yes. In the Department of Mental Health, in the rules and standards of, for instance, the CPRP program, which we've talked about in the previous training session, there's a limitation on how many folks that they can serve on their caseload. But the supervisor of the community support team, for instance, would assign so many families or so many adults, whatever population you're serving, to provide services.
So there's a supervisor that oversees community support workers, and that supervisor assigns clients to particular caseworkers.
That is true. Now, another function of the team itself could be staffing new applications for services, for instance. And some of your team members may have more expertise in, for instance, a domestic violence issue. And so it would follow that that particular team member might be the right choice to be the service provider.
How do they bill for those services? Do they write out an invoice?
Well, no, they don't write out an invoice or a bill. They write out a service activity log. Some organizations have amalgamated that service activity log within a progress note. Other organizations just do a billing slip. Individually, the community support worker or the doctor or the clinician would fill out each individual piece of paper for each service provided. If we're in a group situation like a clubhouse or a day program or group counseling, then there's usually a sign-in sheet and that everyone that's signed in, then all of that information, that documentation goes into a billing department in an organization.
Well, that's really interesting. I've never really thought that much about it, but you bring up a good point. Who develops the mechanism of reimbursement, the dollar attached to a service, and how does that work?
Okay. Within the Department of Mental Health, in the organizations that are providing services, every year the legislature votes for what we call an allocation of dollars. And the allocation of dollars is given to the Department of Mental Health. And then they decide through a formula that would be too technical to go through at this point, but each organization or provider or program gets a particular amount of allocated dollars, and each organization can then bill against that allocation of dollars through a purchase of service catalog. And that catalog lists and identifies each and every service, whether it be counseling, case management, day program, group counseling, lab work, medication services. All of those have specific codes, and the organization bills against those codes for whatever was documented that had been served, and then once a month they bill that to the Department of Health, and then they are reimbursed through that mechanism.
That sounds very technical.
Well, it's once you get the catalog, then you can kind of learn what kinds of services you've been authorized to provide and what you can bill against. Again, I always encourage folks to know that if you've done the work, that's wonderful, and that's what we're here about, but you've got to document it in order for it to be reimbursed.
So I guess it's really important then to make sure that the services you're providing are consistent with the need of that individual client. Otherwise, you could probably get in a lot of trouble for not providing correct service or providing inadequate service.
And most of the services provided are to be individually plan driven. Some people call it a treatment plan, some call it a rehab plan. I like to call it individual plan. And whatever is authorized in that individual plan is what you should be able to bill for.
And I suppose there's some kind of auditing system that people can, from outside, can review whether or not an agency is providing the kinds of services for which is being reimbursed.
Actually, in the Missouri Department of Mental Health, we've got a couple of ways, or 3 ways. We have a supportive community living program that is a separate department in the Division of Community Psychiatric Services, where they come and monitor organizations and hold an invoice that the organization sent to the department against a progress note or a pharmacy bill or a lab bill, and to see if they match and if it's reasonable and necessary. There's also audits done by the Department of Mental Health generally under the business practices and how monies flow and how things are paid out, how client funds are used. And then each organization is actually, per standard, asked to annually have an outside audit review to see that the Missouri taxpayer money is being used as authorized and approved.
Well, it sounds like that could be a 60 Minutes project.
Well, could be. But what's important here, too, is that, again, I want to say the community support workers need to understand they're one of the most valuable pieces of any organization in terms of what happens to an individual, what service is provided, has to be documented in order for the organization to bill for it, for the organization to get paid for it, and for the community support worker to get paid their salary.
I want to switch gears a little bit. In the first training video, we talked mostly about the structure of the Department of Mental Health in Missouri, and that kind of led into this discussion that we're having with regard to what does it look like for a community support worker and for clients receiving services, which led to a discussion on funding mechanisms. But now I want to talk a little bit about the competencies for a community support worker. what competencies would you expect in me, for instance, if I were interviewing for a job? What would you expect me to come in with in terms of my background and competency skill set?
I can probably group several competencies into two very, very important skill sets. One would be clinical skills and knowledge of systems, and two would be relationship building skills, where the individual case manager's attitude, emotions, relationship building skills, liaison work, how they can get things done by liaisoning between people that may not always agree on things, and to work with children, work with families, work with adults, work with systems, and how they do that, what kind of frame of mind are they in to do that. The clinical skill set and systems knowledge, I think, speaks for itself in terms of what kind of clinical skills do you need to have? Do you need to understand what a diagnosis is, what kinds of best practices are out there, and the systems knowledge is what systems are there out there that you can access for the provision of services. But more importantly to me is the attitude, the emotion, the unconditional philosophy of wanting to do whatever you can do to help somebody along the road to recovery is the most important.
So you could have someone who really knows a lot of information regarding systems and diagnostic categories, but if they're not able to empathize or develop relationship, they would probably not be very effective.
I think that's true, and nobody's happy in that situation. If someone comes to apply for a job as a community support worker, I would want to know what would be the best thing that somebody could say about them in the field of work, in serving other people. What's the worst thing somebody could say about you in terms of working with people, and can we live with that? How do you look at individuals that are going to be served by you? Are you looking at a person, or are you looking at a disability? I always believe we should label jars and not people. And with that philosophy, the person was born first. The diagnosis or the disability is just something on their shoulder that needs to be navigated through and helped controlled, if that's the right word, or managed. But the person, all of us, whether we have diabetes, heart disease, schizophrenia, bipolar disease, we all have families, we all have the desire to work, we all have the desire to have friends, love, relationships, marriage, children. All of those things live in all of us. And to be able to support those efforts and those dreams and those desires, I think is the greatest gift with hope that a community support worker can give an individual needing services.
It sounds like we all have a story to tell.
Yes, we do.
Thank you, Barbara, for talking with us about the system of care, specifically in the mental health center's team process and competencies for case managers. I would encourage you to, who are looking at this training video, to review the glossary of terms and also practice the points of application in addition to looking at the key concepts. And if you do those things, you'll have no problem taking the test. Thank you.